Hi, I'm Shari Adams. I'm a registered nurse out of Tyler, Texas. I work in an outpatient cath unit, and I have come here to make my life better, and Dr. Ortiz was recommended to me, so here I am.
When special cases like Shari contact us, our first evaluation is over the phone, and to say the least, her situation was very unique.
In 2003, I had a non-adjustable band put in Houston, Texas, and shortly after the band was put in, I felt like it was not working. I originally lost about 50 pounds, and then I started gaining weight again. And when I talked to the doctor, I was not overly pleased to his response, and eventually I just gave up. And now it's 7 years later, and it's time to do something.
She had a gastric band, but not the typical normal adjustable gastric band. This surgeon uses a non-commercial, basically non-manufactured band, non-adjustable, not even FDA approved, and places it around the highest part of the stomach. Unfortunately, it is not that less invasive. It really does do a lot of damage, especially to the outer linings of the stomach.
I'm a diabetic. I have high blood pressure. I have chronic back pain. The added weight that I'm carrying does not help my back pain at all, and it's gotten to where the pain was so intense, it's 24/7, that my estimation was before I did anything else I had to lose some weight. A friend of my sister's had been to the OCC prior to this and recommended Dr. Ortiz and his staff, and so I looked him up on the internet, and within days I had called and talked with everybody and made an appointment, and here I am. Originally made the appointment to come down here. Dr. Ortiz was on vacation, so we had to wait a couple of extra weeks to get down here. Flew in, his staff met me at the airport, got me over to his clinic where we did pre-op labs and the pre-op things that we needed to do prior to surgery to make everything nice and safe for me. His staff is excellent. The hotel that I'm staying in is wonderful, and Dr. Ortiz and Dr. Martinez both got to talk with me, and I felt very confident in going ahead and proceeding with my procedure. What I wanted to do is I wanted my band removed, and I wanted the gastric sleeve done.
Well, she arrived, she had her evaluations, saw all our staff, our nutritionals, critical care specialist. We did all the exams. We typically do an endoscope and a barium swallow. Every single test needed in order to determine her health status and to determine the status of the implant at that point that we were going to remove. I had a talk with her. We sat down prior to the surgery, and I told her what to expect. And for us, it's very important that the patient knows that there is a possibility that the surgery she came for might not happen. And what I mean by that is our most important goal is to keep her safe. Of course, we were going to remove that implant she already had, but we're no heroes here. As long as we can proceed safely, we will do so. But if at any point more damage will be caused by the additional surgery, it's not worth it. Patient's health and life goes first.
When I woke up, I found out that I'd been in surgery 2.5 hours with Dr. Ortiz struggling to get my band off. And he found that the band had done so much damage to the stomach mucosa, he had a lot of repair work to do, and that the gastric sleeve was not available to me.
When she woke up after the surgery, I gave her the good news and the bad news. The good news was, well, we removed the band, non-adjustable band that surgeon had implanted, but unfortunately there was too much damage to the outer linings of the stomach, and we couldn't perform the gastric sleeve safely. I had a talk with Shari, and I gave her the good news after we all sat down and analyzed her case. And since we couldn't perform a gastric sleeve through stapling, we thought it a wonderful option to use the actual stomach and just plicate it or fold it inwards and perform a gastric sleeve by plication, which is now known as gastric plication. Ideal scenario, too much damage to her outer lining. We couldn't perform stapling safely, but the folding was performed and she had a wonderful result, a very quick recovery, and she's extremely happy.
I had read about the plication because that was one of my options, with the gastric sleeve or the plication, and so when Dr. Ortiz said he was going to do that, I had no worries whatsoever, and like I said, I'm on top of the world right now. I got here on Tuesday, and well, I got to the clinic for surgery on Tuesday, and after a brief recovery time, they had me up and walking. I had no pain. I was a little sore, but other than that, there was no pain associated with this procedure. Just a little bit of disappointment originally. I stayed through Thursday, actually through Friday. Thursday, after the plication was done, again I woke up. I had no pain. I had a little bit of soreness at the incision site, which you can't get cut on without having some soreness. They had me up and walking around. The staff was excellent. They took very good care of me. I can't do anything but highly recommend OCC. Everybody knew their job. Everybody was on time with what they had to do. And as a registered nurse, I've worked in surgery before, and I can't say enough about OCC. My family was not happy about me coming to Mexico. There's been so much in the news lately about the violence and unrest here in Mexico. They wanted me to stay local. Number one, they could visit me at the hospital. Number two, I was going off by myself, and my family is very, very protective. But again, through researching the internet and talking with Dr. Ortiz and talking with Dr. Martinez and Lori, Becky, and everybody, the staff, I had no qualms whatsoever about coming here. And I'm telling you right now, I made the right choice. Although I hated the fact that the band did so much damage, hey, I'm part of your team now. I'm part of one of your patients that have had the plication that you can check up on, and hopefully I'm adding to your knowledge and your research. And I don't know whether this will get on tape or not, but I told Dr. Ortiz earlier today that, or I was telling somebody that was standing next to him, that I would step in front of a bullet for him. I truly love this doctor, Dr. Ortiz, Martinez, Velasco, Dr. So, Dr. Who is my anesthesiologist? I can't pronounce his. San Miguel. That's it. The staff is wonderful. If you need this done, this is the place to come to. And whether it's a lap band, whether it's a gastric sleeve, and I've talked to gastric sleeve people that have had it done, whether you need a plication, don't hesitate to come down here. I truly recommend this. I will recommend this to anybody that has a weight problem. And again, I'm not down here to get beautified. I'm down here to lose the weight so that I can get out of this chronic back pain, maybe solve the diabetes, the high blood pressure. I think all of this is going to come to fruition here, and you can't. I don't think you can go any place better.
Well, our main goal is that not only that the patient is safe and has a successful surgery. We want the patient to feel comfortable. We want the patient to feel cared for. And everybody, the whole staff, from our nurses to our surgeons to our anesthesiologists, everybody does their part so the patient can feel comfortable and at home being so far from home. Yes, this one's for the books. It's a very unique case. We are going to report this in the literature because it is a wonderful option. And it's good to have all these different types of procedures and expertise in these different areas so we can apply it when the time comes.